Hello, beautiful souls. Welcome back to my channel, Unmute with Priya. I'm your host, Priya. Let's dive in. In our last episode, we talked about why people don't listen to you, how frustrating that is, especially when you think you're explaining yourself. And I shared some everyday examples, my tire shop experience. But today, I want to take that conversation to a place where the stakes are so much higher, the doctor's office. Because when a mechanic doesn't listen, it costs you time. When your doctor doesn't listen, it can cost you your health and even your life. And for women, especially women in midlife, this happens far too often. We know our bodies, right? We can explain our symptoms, but instead of being heard, we're dismissed or told it's just stress. So in this episode, we're going to unpack why this happens, how cultural conditioning may have a play in this, and 3 ways you can advocate for yourself so that you can leave the doctor's office feeling respected, seen, heard, taken seriously, and most importantly, in charge of your health. So I want to share a story that maybe some of you can relate to. I was experiencing some pretty significant symptoms that were perimenopausal a few years ago. I went to my OBGYN and it felt like a UTI. Severe burning when I was going to the bathroom and frequent urination. And, I explained this to her and she said, okay, we're going to do an exam, check everything out. And we took a urine sample. The urine sample came back normal. She said, well, it's nothing. And I said, okay, can you tell me what's causing this pain? Because it's so painful. She proceeded to do an exam with the speculum without any lubrication. Now, women, you know how painful that can be, and I've already told her how much pain I'm experiencing in that area. I left that office feeling so unseen, unheard, and dismissed because at the end of it, she told me, oh, it's painful bladder syndrome. I Googled it. It's a generic term that they use when they don't know what's going on. And I didn't leave there with any prescriptions and nothing, no action plan. I took my health into my own hands and proceeded to do natural healing. I went to my acupuncturist, my herbalist, and tried all different things where I finally was able to remedy this within myself. The doctor didn't help me. The doctor didn't even want to hear me. It was a 20-minute visit, got in and out. And I must say, this doctor was a woman. How many of you go into the doctor's office because something feels off? You have lived in your body for decades, so you know that something feels off. You know when something isn't right. You sit down, you explain your symptoms just as I did, maybe even suggest what you think is happening. And instead of listening, they cut you off or smile politely and say, it's probably just stress, or that's normal for your age. How many of you have heard that? You leave with a prescription, maybe nothing, or worse, no answers at all. And then weeks or some months later, maybe even years later, it turns out that you were right all along. That's the moment when frustration turns into something deeper, because this isn't just about wasting time. It's about being dismissed. And for women in midlife, when your health and energy are already shifting, this dismissal can be so devastating, right? Why does this keep happening? Why do so many women feel ignored at the doctor's office? There's a bunch of reasons why this can be happening, but I want to go into 3 that I felt were some of the main ones. First, one that I can relate to is cultural conditioning. Many of us, especially as South Asian women, I'm South Asian, or women raised in traditional households, were taught to be polite, agreeable, not to question authority. So when a doctor dismisses us, we start to second guess ourselves. We wonder if maybe we're overreacting. Second, there are power dynamics. The white coat carries authority. Doctors are trained, they're educated, they are experienced. And yes, they have gone through years of grueling education and schooling to become a doctor, to have that MD at the end of their name. But here's what sometimes they forget. You are the expert in your body. You know exactly when something feels right and when something feels wrong. Third, I want to talk about gender bias. Gender bias does play a huge role, and studies show that women are more likely than men to have their symptoms dismissed, to be told it's anxiety, stress, or hormonal. Women wait longer for pain medication in ERs. Women are less likely to be referred to specialists. This is not in your head. It's systemic. And if you've ever felt invisible in the doctor's office, I want you to know it's not because you explained it wrong. It's because the system hasn't learned to truly listen to women. That has been my experience over and over and over again. A few years ago, 2019, I've talked about this. I had a severe head injury. I passed out and hit my head on the side of the bathtub. And luckily, I woke up from it. I didn't go to the ER right away. And a couple of days later, the concussion symptoms set in. Severe vertigo, nausea, headache. And I took myself to the ER, got myself into a doctor. She sent me to all the different places and told me it's a concussion. I said, okay, that's great, but what do I do for it? She's like, nothing. There's nothing we can do. And for 4 years, I dealt with there's nothing we can do. I wasn't even referred to a neurologist because they told me, you're not going to be priority for a neurologist to see you. Luckily, 4 years later, I did get in to see a neurologist and she heard me. And I was able to voice everything because by that time I had found my voice. I would explain that I felt like I was having worms in my head and nobody would listen to me. They just said, yeah, that's part of the concussion. And luckily this doctor got me into all the right places. For a good 2 months, I was going to one doctor after another, and she validated that, yes, I probably had a very significant concussion. There were things that I could have done early on, but what I was experiencing were residual effects of the concussion and not having treatment for it. So let's talk about what you can actually do, because yelling, will you just freaking listen? It doesn't usually work at the doctor's office. But there are ways to advocate for yourself and find your voice in this process. So framing is a really important tool. I love framing. So framing the conversation before it starts. Just think of what a frame is. You put your picture inside the frame. Instead of just launching into your symptoms, set the tone. Try, I need you to hear me out before you respond. Or, I'm not just looking for reassurance. I need some answers today. This makes it super clear that you're expecting active listening, not dismissal. Frame it in any way that you feel fit, but framing really sets the tone. That sets the tone for being heard, being seen, and being validated with the symptoms that you're experiencing at the doc and what brought you to the doctor's office to begin with. The second technique is bring notes and use confident language. Doctors are used to charts, data, structure. They're analytical. They like evidence. So bring a short list of your symptoms, how long they've been happening, and what you've noticed. Instead of saying, I think it's, maybe it's nothing, try, I know my body and something's not right. This is confident language, and confident language shifts the dynamic. So I know my body and something is not right. So when we use that, I think maybe it's nothing, that's just a pattern that us as women have learned to do over time. Think about how many times you use that in all your relationships. With a partner, when you're experiencing that something's upset you, I don't know if it's a big deal. Maybe I'm making a big deal out of this, but... Or you're talking with another friend about something else and you say, well, it's not a big deal. Maybe it's nothing, but stop prefacing everything. We don't need to be doing that anymore. Just get to the point and start developing your confident language. The only way you're going to develop confident language is by actually using it. You think of it as a muscle. The only way it's going to get stronger is by using it over and over and over again. So I know my body. I know something's not right. Confident language at the doctor. If we just rewind a little bit, talk about being at the tire shop or the mechanic. I've been driving my car for 10 years. I know something's wrong. That's confident language there. You really can use these techniques across all different areas. Don't be afraid to push back or walk away. If you're dismissed, you can say, I hear you, but I don't feel satisfied with that answer. I'd like a referral or a second opinion. And if a doctor consistently doesn't listen, you're allowed to find a new one. Advocacy, it's not disrespect, and it's you stepping up and showing up for yourself. And it's the highest form of respect that you can give yourself. Dismissal also happens when you're advocating for others. So if you're at the doctor's office for your child, even at a vet for your pet, if you're like me and you have aging parents and you're advocating for your parents, this can happen in any situation. If you're feeling dismissed, you can ask for a referral or a second opinion. If your insurance doesn't require that, you're allowed to leave and find one for yourself. Advocate. Speak up, because you know best what's going on in your own body. You know what's happening, what's best for your child. You know what is best for your pet, and you know what's best for your aging parents too, especially if you feel like they're being dismissed. I'd like to give an example of that with my parents. We had a telehealth visit with one of the doctors, and my parents, South Asian, they put doctors up there, and the doctor was speaking to them and just pretty much gave the diagnosis, gave the medication, and that was it. And my parents were both, they changed their tone, and I was like, who are these people? Because they were saying, yes, doctor, yes, doctor. And I spoke up. I didn't care whether he was a doctor, whether he was my equal, not equal. I didn't really care. I spoke up saying, no, we need a referral to this place. And he got really defensive and angry with me. My parents were worried that I was crossing some boundaries, and I didn't really care. Afterwards, I voiced to them how dissatisfied I was with this visit, and my dad will no longer see this guy. And we got him into another doctor right away. Advocacy is a power tool, and learning advocacy, confident language, is the best thing that you can do for yourself, especially at midlife. Now, I want to tie this back to something deeper for many of us, as I mentioned. Now, I want to tie this back to something deeper for many of us, especially South Asian women. We were raised to defer to authority, doctors, teachers, elders. We didn't question. What they said was gold. You believed it. You listened. You didn't even argue with them. But midlife is the breaking point. Menopause, health shifts, and just the lived experience of decades in this body finally wake us up to this truth. If we don't speak up, no one's going to do it for us. Think about it. Think about it in all your relationships. If you don't speak up, no one's going to do it for you. If you're at work and you want a raise, is your coworker going to speak up for you? No one's going to do it for you other than you. If you're at the supermarket and you want something, you have to learn to speak up for yourself. If you're at the doctor's office, learn to speak up for yourself. And this is why unmuting is not just about relationships with partners or coworkers. It's about reclaiming your right to be heard in every room, including the exam. So here's my invitation for you this week. The next time you go to the doctor, walk in with a mindset that you're the authority in your body. The doctor's not the authority. They're an expert in medicine, but they're not the authority of your body. Frame the conversation. Bring your notes, and don't leave until you feel heard, until you get what you need, until you feel satisfied with what you're leaving. You deserve doctors who listen, respect, and collaborate with you, not dismiss you. And if you want to go deeper into this work of finding your voice in relationships, no matter what that relationship is, doctors, friendships, intimate partners, I have a free resource, a training called 4 Steps to Finding Your Voice in Relationships. And if you go to the link below, www.unmutewithpriya.com, you can access that for free. And for a limited time, apply for a free 20-minute coaching call with me. These are normally $197, and I'm offering them for free. And if you're craving a deeper transformation, you can apply for one-on-one coaching with me. The link is below. And I'd love to hear from you. Have you ever felt dismissed at the doctor's office? What did you do? What do you wish you had said? Drop it in the comments so we can continue to support each other through this topic of unmuting and finding our voice. So just know, as we end this episode, don't forget to like, subscribe, and share this channel if you resonated with this content, and share it with somebody who needed to hear this message today. I love you, I see you, and I believe in your right to be heard, especially when it comes to your health. And I'll see you for the next episode.